record disclaimer.
Yes, El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. Well, here we go again. We're getting into the flu season, and we're obviously dealing with a COVID crisis around the country. But the news is not all bad, but we're here to talk tonight about the flu season and COVID and how we avoid the Twindemic. We are, of course, live, and we take call-in questions all the time. And we encourage you to please call into our show if you have any questions on this very, very important topic. The number is 881-0013. Again, 881-0013. We encourage you to call, please. This is a very, very important and timely topic. This evening's program is underwritten generously by the American Heart Association, and we also want to thank the Texas Tech Paul L. Foster School of Medicine for always providing us volunteers, wonderful volunteers, to staff our phone lines. And with us tonight is Madeline Morris, and Madeline is a veteran and is certainly not new to this show. Madeline, thank you for what you're doing, and you're a second-year medical student and going to be contributing greatly to our society and to the health of our citizens. So thank you, Madeline, for being with us again. We also want to thank the El Paso County Medical Society for bringing you this show on a monthly basis. We're grateful to them as well. Good evening. I'm John Barella. I'm filling in for Catherine Berg, and this is the El Paso Physician. Welcome back, and thank you again for joining us this evening on a very, very important topic. The influenza season is upon us, and of course COVID-19 and the various variants continue to plague us, not only here but around the country, although as we'll see, the news is not all bad through our discussions this evening. But we have to continue to be vigilant and ever mindful about the threat that it continues to pose to all of us here in the region. With me are two excellent, well-renowned doctors in our region, and we're really privileged to have both of them here today. They've both been on this show before, and we're thrilled to have them back and welcome them back. First, we have Dr. Oge Olozi, who's with us. He is the medical director for Sunset ID Care, and he's an infectious disease specialist. Very, very well versed on this subject, and we're grateful to have him here.
Thanks for having me.
Absolutely, and welcome back. Good to see you again.
Just yesterday.
Time flies when you have fun.
Absolutely.
And with us also is Dr. Andres Boadea, who is a pediatric medicine doctor, pediatrician, who certainly works very, very hard, very beloved doctor here in town. And you can see him working at Las Palmas and Del Sol Medical Centers. And to get going, I just very briefly want to ask each of you your course to get here to El Paso and some of the things that you're doing. Very brief introduction for the viewers. I know many of them already know you, but.
I've been here 12 years. I don't know how long Andres has been here, but I'm born in Nigeria, grew up in Minnesota, did all my training in Minnesota, and then we moved to El Paso in 2010. So it's going on 12 years now. This is my home.
Well, welcome back home.
You.
So you be here a little bit of time. It becomes home very quickly. It sure does. It sure does. And Dr. Boadea, we were talking earlier, you're a native El Paso.
I'm a native El Pasoan, so I've been in El Paso for 44 years, a little bit longer than Dr. Ogie, but yeah, native.
Well,
so,
where'd you go to high school?
Cathedral.
Yeah,
I went to Cathedral High School.
Very good.
Irish.
There you go. Go Irish. So we're really proud of you. It's always good to see the local folks go get educated and come back, and of course having the expertise of Dr. Olozi is always appreciated. So thank you both for being here again. Our topic is a very, very interesting one and extremely timely. And we can never be too careful about how we try to prevent the spread not only of the regular flu, but of course the COVID-19 and its various variants now that are out rolling around the country and whatnot. So I'm going to start off the questioning with Dr. Olozi. One of the questions that I have, is certainly in the back of my mind, is this cold flu season. And you know, last year it seemed that maybe it was just because there was such a focus on COVID that the flu, the regular flu, didn't seem to affect or inflict many people. Or so it appeared.
Yeah.
From your experience, and both anecdotally and the data, is that true? And
Yeah,
why is that the case?
Absolutely true. So the why is the hard part. I think it's important to just say what happened, which is that in the Southern Hemisphere and the Northern Hemisphere, flu dropped around 98 to 99% across the globe. Right? We're not clear why that is. Part of it was the masking. Part of it was the physical distancing. Part of it was that kids weren't in school, right? Especially in the Northern Hemisphere and partially in the Southern Hemisphere. And so I think we were lucky, and sometimes I've said it's better to be lucky than to be good. And so in that case, it dropped off. Not sure where we're going to go with it, and I think we can sort of talk as the evening goes along what a twindemic would look like and what the potentials and the possibilities for that is into the future as well.
Yeah. Do you expect that trend to continue this year?
We don't know. I mean, if we pull up slide 1, if we can, I mean, if you sort of look at the curves that we've had historically around flu, right, we expect it to sort of peak and then drop off. What we realize is that in 2020 it didn't. If you look at the Southern Hemisphere specifically, they haven't yet seen flu. Right? And they haven't been as restrictive as we have in the United States. So who knows? I think what's important for people to understand is that in a good flu season, 30 to 40,000 people die. Right? And so that really is a concern, not just this year, but I think multiple years going down the line as we realize that SARS-CoV-2 or COVID-19 is not going anywhere. It's going to become endemic in our society. And I think the real focus here is that the best way to avoid this is to get vaccinated, not just for SARS-CoV-2, but also for influenza.
So for our viewers, there was a slide up. I don't know if we can pull that back up or not, but maybe you can take the viewers through that slide that was up there.
Right? You'll see 2020. That's the sort of cherry red, I guess. And you see how it sort of dropped off as the course of the year went. By the time we sort of locked down in March, April, you can see that influenza cases across North America essentially disappeared. And that was the 98 to 99%. You can see at the bottom, I guess it's a purple, I'm sort of colorblind. You can see that right now we're flat. We do not know what's going to happen going into the fall, and I think that's why it's important for people to be diligent, it's important for people to be careful, and for, again, get vaccinated when you can. I don't think this should really be an argument. I know it will be, but it is what it is.
Yeah, agree with you at that, Doctor. Unfortunately, it's gotten politicized, but the facts speak for themselves, and so do the data. The title of our show, once again, is The Influenza Season and COVID-19 Infections, Avoiding the Twindemic. And if you have any questions, once again, we urge you to call in at 881-0013. Again, 881-0013. I'm going to turn now to Dr. Boadea, who is a well-respected pediatrician here in town.
I hope so.
Yeah,
Absolutely.
we know so. And once again, welcome, Doctor. We appreciate your being here with us this evening. First question I have for you, really two-pronged question. Number one, are you currently seeing a spike in COVID infections among the folks that you see, the young people that you see? And secondly, do you see this being a problem as we move into the flu season? Having the flu, perhaps spreading the regular flu with young people and kids, along with COVID. So what do you think about that?
So honestly, we initially when back to school season started, everybody was concerned about the possibility of COVID-19 spreading and spiking. As you know, children are one of the main drivers of viral infections. And so there was a big concern for COVID. However, I think that El Paso has a high vaccination rate, and that's helped a lot. And so looking back to early this year, we saw how the numbers started dropping drastically, the hospitalizations started dropping, the amount of space available to patients at hospitals were more available. And so that vaccine kind of speaks for itself that it was working. And so because of that high vaccination rate that we have in El Paso, we haven't seen a tremendous amount of COVID-19 in the pediatric population in children. However, as Dr. Alozzi was saying, we were apart for such a long time that we have other viruses that have started flourishing a little bit more. RSV in babies that causes bronchiolitis, adenovirus, rhinovirus, enterovirus, all of these viruses, which can also have respiratory symptoms, have driven patients to be hospitalized, but not so much COVID as we would expect it or thought that it would happen. As far as my patient population goes, there is a high vaccination rate in the pediatric population, which is right now authorized from 12 years and over. So in that population, there's a high vaccination rate. And you see the hospitals are full of patients that are below that age. Mm-hmm. And then the other part to your question, I'm sorry, was
do you expect this flu season to, first of all, see a spike in flu cases with young people? And do you see a corresponding spike with any variant that you see on the horizon affecting young people? You know, you got the Delta variant, the Mu variant, and all of that.
Right. I believe that we are going to have a spike in influenza.
And why is that? Is this kids going back to school, as Dr. Alozzi?
If it mimics what is happening right now with RSV and rhinovirus and enterovirus, if it's going to mimic what is happening right now, there is no doubt that there will be a spike. However, we do have vaccines that are available now for this season's flu virus. And so if we vaccinate, maybe we can kind of not, have that big spike in flu. And it doesn't mean that you won't get it if you're vaccinated. You can get it, but it will be much more mild. It won't drive you to the hospital. And, as you're saying, Twindemic and co-infection with COVID and influenza, I mean, I'm sure it's going to wreak havoc on, respiratory systems and most importantly, hospitalizations. So if we vaccinate, if you visit your doctor, if you visit your pediatrician and you follow the recommendation of your physician, maybe we can make the influenza season a little bit more mild.
Yeah. Thank you. Dr. Alozzi, this is a question from my mom. So she may be watching tonight, but she's 83 years old.
Okay.
She's already received the double dose back in March. And her question really is now she always gets her regular flu vaccine in October. The question is, can she get a regular flu vaccine shot come next month in October that she gets every year? And can she get a corresponding booster if that's recommended by the administration or CDC?
Yeah, definitely. So I think, first of all, I think it's a great thing that she gets it every year. She's protecting herself. I think that really, to cut to the quick, yes. The short answer is yes, she can get the influenza vaccine, and yes, she can get the COVID-19 booster. And so initially, sort of when we were rolling out vaccines back in January, February, there's some conversation about don't get two vaccines at the same time. The CDC and the FDA have changed that so you can get both vaccines at the same time. The reality is it's going to be about availability. What is the availability of the booster to her? When is she going to get the vaccine for influenza? But I think if she's able to get it at the same time, why not? Saves her an extra trip, saves her the trouble of going to her healthcare provider multiple times.
So you can get the shot at the same time.
Absolutely.
The regular flu shot, to be clear, and the booster at the same time, and it won't have any adverse effects on her or anyone else in that age group.
Absolutely. And I think to sort of drive into the booster a little bit more, she is in that population where the data is pretty clear in terms of providing extra protection, not only against infections, but also against hospitalizations and death for specifically SARS-CoV-2. And so I think it's important for her to go get it.
So along those same lines, I saw an article, read an article this morning where I believe it was Moderna is trying to develop, of course it hasn't been approved yet, but develop a one-shot COVID and regular flu vaccine. Do you have any updates on that, or is that going to be viable in the near future?
Yep, so I think it's exciting, unlikely to be available for this season that we're going into, because as you understand, There's trials that have to happen. FDA has to give approval. The Advisory Committee on Immunization Practices, ACIP, they have to give approval as well. But I think it's also important to sort of set the stage for what's coming into the future. Not necessarily this year, but years to come. As SARS-CoV-2 becomes endemic, as we continue, like Dr. Bodea said, to have a return of influenza, the winters are going to be tricky, right? We're not going to know, is it influenza? Is it RSV? Is it SARS-CoV-2? And so I think people need to sort of prepare for that and understand that on average, even before COVID, our hospitals hit capacity levels in the winter months because of influenza, both on the pediatric and the adult side. A twindemic that becomes consistent every year will be challenging. And so we're going to have to enable people and sensitize people to realize that, hey, this is not going away. This is not something that in December of 2021, all of a sudden COVID's going to disappear, and so we can sort of push it under the rug. We're going to have to learn system-wise and information-wise, and having programs like this and having physicians and clinicians across the community continue to remind people that this is not gone, and so the best way to protect yourself continues to be by getting vaccinated.
Yeah. Dr. Boyle, are you seeing patients now, young patients, that are coming down with the Delta variant here in town? Have you had a spike in numbers, or has it been relatively flat?
The testing that is available to us will not differentiate just your regular COVID from Delta, Mu, Lambda, whatever variants are out there. We have no way of distinguishing. I don't know if there's labs here in town that can do that. I know that sometimes we have to do send-outs, and then eventually you get your results. However, we can say if you have it or don't have it, the COVID with a COVID test. But it hasn't been available to us as far as the subtypes or the variants of coronavirus. You know, hopefully in the near future. But again, we as far as the variants go, I have not seen the subtype of COVID yet. I don't know if Dr. Alozzi.
Yeah, I know exactly what Dr. Bodea said. I think that, and we get these questions a lot, right?
We
How
do.
I know I have the ancestral versus Delta? And I tell people it doesn't really matter. It's not going to change how we treat you. It's not going to change the vaccine, right? And so I get it. People are worried and they're concerned. But I think what's important is that the CDC data shows really clearly that 98 to 99% of all surveillance types in the United States are Delta. And so that's how we approach it. And well, what does that mean to individuals? It means that it's more contagious. It means that it's easier to get, probably 3 to 4 times easier to get than the original ancestral variant was last year. And so again, we've said it before, this is the most dangerous time to be unvaccinated in the United States. I think we're blessed and lucky. Again, sometimes better to be lucky than good, but we're blessed in El Paso that we are not seeing the sort of rates that they have in Florida or other places in Texas or some of the Midwest. And so I think part of it is, like Dr. Bodea said, is the work that we've done in our community around vaccinations. That's been critical. But I also remind people that it's also sort of, this, I always say, sort of on the shoulders of giants. In this sense, it's on the shoulders of angels, right? The people that we lost last year, right? We lost an immense amount of people, and we infected a lot of people. And so that plus vaccinations is really what has allowed us to have some of the best rates in terms of infection and safety in El Paso.
Yeah. You know, there's a question I know you've probably answered dozens of times, and I've certainly heard it being asked many, many times, and I think it bears repeating, and that is simply this: if somebody has had COVID in the past, should they go get vaccinated?
Yeah.
And if so, why?
So I think, here's the thing, reasonable people can disagree, but I think what has happened, and you sort of talked about this earlier, is we've become so tribalized and politicized around views that we've forgotten that data changes, right? As an infectious disease physician, what I used to treat HIV and bone disease a decade ago is very different today, and I'm sure it's the same in pediatrics.
Right.
What we've seen is that early on in the pandemic, the conversation was, you must get vaccinated. And I think that was fair, right? It's what we had. The data, both from the United States, Europe, and from South Africa, is now showing that we need to sort of take into account virus-driven immunity, right? There's 2 pathways to immunity. There's vaccine-driven immunity, and there's virus-driven immunity. And people that have been infected previously, I think it's a fair conversation for them to say, hey, I just want one shot. And I think the data is beginning to support that. The CDC has some of that data. It was talked about a few weeks ago on a CDC call. Europe is doing that. In fact, Israel, where we get most of our vaccine push and data around boosters from, has actually created a vaccine passport, and they now acknowledge previous infection plus one shot as being equivalent to 2 shots, right? So again, are we there from a guidance standpoint from the CDC? No, not yet. Do I think we'll get there eventually? Yes.
So if I've been infected with the Delta variant, or excuse me, the original variant, the Alpha variant, I guess it is, and now I have the Delta variant, will my prior infection with the original COVID variant, will that offer the same immunity as protecting you from a Delta variant?
Yeah, and I think, again, great question. I think part of the conversation is, what does the human immune system work like, right? The human immune system is not a carbon copy system, right? It's a lot different. It identifies things, and then it says, well, I can figure out all the cousins and aunts and uncles of this thing, right? So the antibodies are that first line of defense, but the B and T line, and this is getting way too wonky, and I apologize, but we have
this is very important.
we have multiple other pieces of our immune system that actually now say, you know what, I can figure this out. It doesn't have to be an exact replica. And I'll give myself as an example. I unfortunately got COVID December 18th of last year. Was lucky and blessed, didn't have a lot of symptoms. Actually got the monoclonal antibody because I was a lot heavier then and older. Well, I wasn't older then than now, but you know what I mean.
You look young, and you look you look in great shape. So
yeah, but and so because of that, when I was ready to go off to Curacao and do some work for 2 months there, when they were having their COVID surge, I actually deliberately got the Johnson & Johnson. Right, I wanted one shot. I needed to get out of the country and have, for research reasons, tested my BT and antibody immunity levels, and they're massively high. Right, so I'm not worried personally. But again, I think that's where the data is evolving. It's emerging. I think that's sort of the party line, and I think Dr. Badea would agree to this: get vaccinated. Right,
100%.
You know, the funny thing is that I don't think this is an argument in our community. Right, and I think we get drawn into the press in other communities making a big deal about it. In El Paso, and I'll defer to you, I just don't see this. I don't see immunizations as something that is contentious. What do you think?
No, I agree 100%. I mean, I immunize in my practice every single day, multiple times over and over and over. You know, you have your childhood vaccinations, you have your teenage vaccinations, of course you have meningitis, and you have HPV vaccines, and at the end of the day, it works. I mean, they work. They do their job. I don't know. Well, I'm not going to get into politics and politicizing, but it is a constant struggle where people don't believe in it, but I live it every single day. So
I just want to echo your sentiments for both of you. We're very blessed to live in a community that really hasn't politicized this as an issue. I come from a political background, a legal background, and I mourn when I see communities being split, our nation being split over this issue. It should be a unifying issue for all of us. And sadly, in many parts of the country, it's ultra politicized, but I think we're pushing vaccination rates here, correct me if I'm wrong, of near 80%.
80 and above, yeah.
Which is phenomenal. We're leading the country in that in so many ways, and it just really should hearten all of us that we've come together as a community. In southern New Mexico, the same thing. It should be very heartening and very encouraging to all of us, despite the bad news here. And as I said during the introduction, we're going to talk about some good news as well, and that's certainly a good news story that we all should be very proud of here in El Paso and El Paso County. So I'm going to turn to Dr. Badea on a very, very touchy subject, I think, in a different way. I've heard a lot of folks say that young people who get the COVID virus doesn't affect them at all. They shake it off. No issues, no serious side effects. Is that true or not? Yeah, we assume young people certainly have the ability to fend off infections more than maybe somebody who's more mature. But is that a reason to not vaccinate a child? that's eligible to be vaccinated?
Absolutely not. Absolutely not. You have to remember, again, I said before, children are one of the biggest drivers of viral infections. So just come to my clinic and hang out with me for a week, and I guarantee that you're going to be sick by the end of the week.
Yeah.
But children have a little bit of a different immune system than adults. Children still have a thymus gland, for example, and so their immune system is maybe a little bit stronger. It's waiting to be programmed. It's waiting to get, it has to get to know these different types of bugs and viruses in order to have an immune response against them. And so because of that, thymus gland, and it's a much younger immune system, maybe, that's why they don't get as sick. However, I have seen a couple of that Kawasaki-like syndrome. I've seen 2 patients have it. Both were hospitalized. The symptoms did not all fit Kawasaki's disease. However, the cardiovascular involvement was there. Some of the features that you can see, the facial features like the swollen lips, the swollen tongue, that was there. And then you run, and Kawasaki's disease is a disease diagnosed clinically. There's not a specific test that will say yes or no, but there are parameters that you can follow that can guide your diagnosis. However, not everything fit into Kawasaki's disease, and so that's how we knew that, previous exposure to COVID, maybe weeks to months before, was eventually causing these issues down the line. So they would be COVID positive, they would take antipyretics, medications for fever, and they did fine. But further down the line is when they would hit. And so initially we were at a loss. We didn't know what was going on. And so that's how we came with the Kawasaki-like syndrome. So it's not all good news for children. I've seen respiratory distress in children. I've seen children that have had to be hospitalized in the ICU setting for respiratory support. But it's a smaller population of children being affected at that degree when you compare it to the adult population. Mm-hmm. So kids are not young adults.
Along those same lines, have you seen, or have your colleagues seen, young kids who are long haulers, so-called long haulers? That's the first question. Second question is whether young people, children that get COVID, does that affect their developmental possibilities, the pulmonary system, lung development, and that sort of thing?
It's too soon to say. Everything is so new that there's still a lot of what-ifs up in the air. I'm sure it's going to have a negative outcome at some point to certain kids. Hopefully not, but it's still too soon to say if it's going to affect their development. I have seen though that a lot of kids were affected more with depression and anxiety and all these issues of lost family members, of quarantine, of social isolation. So, a lot of people, or when schools closed down, it was very traumatic to some because a lot of these children were depending on their school for either shelter, food, some type of attention. So in that aspect, I have seen COVID affect the younger population, but it's more of a behavioral issue that they're going through. A lot of children have lost family members, including parents, that I have had to tend to and help them cope with these issues.
Dr. Alozzi, have you seen this issue, the COVID issue? Is that a function of income? Or is it an equal opportunity infector, as it were? And what's your experience with that?
You said we weren't going to get into controversial topics. No, you hit me with the hard one. I think it's both. I think that early on in the pandemic, it was an equal opportunity infection. I think what bears understanding, though, is that look at how our communities, not just ours, but across the country, changed right? So as Dr. Bodea mentioned, when we went to in-home everything, work from home everything, who are the people that are best able to adapt to that? It's people of higher socioeconomic status. They have stable internet, stable housing, stable food. Their children have probably multiple devices, a phone, an iPad, a computer at home. That's the population that can protect themselves in a bubble and can continue to thrive in it. Think about, from a sort of financial standpoint, who made the most money in this economy? It was companies and technologies that could quickly adapt to staying at home and working from home. Zoom became bigger than the top 8 airlines in the world, right? And then, to speak to Dr. Bardea's point, the people that didn't, the people that had to be out front, right? Now I'm going to take out our healthcare worker community because we're a little bit different. We had to be out front, but socioeconomically it was different. Think about the people that are driving at stores, at restaurants, at Albertsons, whatever it is. They continue to have to go to work. And that's not always a high dollar amount of income. They were challenged. Their parents were challenged. Their children at home were challenged, right? And so what you have now seen is that initially it was equal opportunity, but over the last 6 to 8 months, it has really skewed to who's gotten. Part of it has been socioeconomic, part of it has been political ideology, unfortunately, and that's what we're seeing a lot of now. And again, people often say, well, it's the vaccine resistant. It's not necessarily vaccine resistant, it's the vaccine misinformed. Their sources of information are not quality sources of information, and unfortunately, that's what they've relied on. And that reliance on poor information has led to a lot of times their demise and their sickness. And so I think that's really what we've seen in the country and continue to see. We're blessed in this community that if we hit 80%, I think it's about 80-ish% according to Dr. Alcaranza, that tells me that 20% are sort of the vaccine misinformed, right? And in all reality, they are taking the benefit from us, right? They're taking our benefit of getting vaccinated, that's protecting them as well.
Well, it's incredibly important information you just gave to our viewers, and very, very valued information. I know, Dr. Alozi, you wanted to show a map of the United States, and this will give our producers some time to pull the map up, and you might be able to explain the significance of that map, and I believe it is illustrative of the infection rate, if I'm not mistaken.
Absolutely.
And we'll give them a moment to pull that map up.
And I want to talk about it specifically because you hear a lot of misinformation about herd immunity threshold or HIT, and people talk whether it's 60%, 70%, 80%, and that's great. I think one thing, and I really call this to attention because it's a two-pronged approach to where we are today. Part of that, and this comes out of the NIH, director of the NIH, Dr. Francis Collins, published this a couple of weeks ago, and this shows what the assumed infection rate in communities were across the country as of December 20th, 2020, right? And so you can see the tip of Texas out there. It's estimated that we were somewhere in the 50 to 60% had already been infected. Right? So you take that 50 to 60% on top of whether we want to call it 70 or 80% vaccination, you can very clearly see, it explains really easily where we are in our community, right? And sort of that, again, you stand on the shoulders of greats, right? We sort of paid the price up front, we did the work after that, and that's why our community has not seen the rates. And I think there was actually an article in the Texas Tribune or Texas Medical Magazine a week or two ago, and it showed the rates of Texas going almost vertical, and it showed El Paso at a kind of very slow increase, right? And that's the protection. And you're in the hospital, I'm in the hospital, a host of our colleagues. Yes, do we see people with COVID that are intubated, that are very sick? Absolutely. On average, I would comfortably say 95% are unvaccinated, and there's still space. Now, what we haven't seen, and I'll let Dr. Bodea talk about this too, a lot of our issues around space are nursing, right? It's not that we don't have rooms, but there's a nursing shortage across the country, and so that's part of our problem.
We're having to import nurses from other cities in order to help out.
So we're still doing that?
Yes, sir.
Absolutely.
Yes.
Okay. The other article I read this morning in preparation for the show was an article that was very interesting. The apparent thesis of this article is that we're on the verge of having a vaccination for children, or the approval for vaccination of children 12 and under. But what really captured my attention is that might include a vaccine for newborns for COVID and potential variants. What do you know about that? What can you tell our viewers about that possibility?
It's still under research. There's a colleague here in town, Dr. Science, who's running a research project for vaccinating the pediatric population. And as far as vaccinating a newborn, right now the only vaccine that is provided to a newborn is a hepatitis B vaccine. I don't know if the research would be there. I'm not sure how many people would be willing to give up their baby to research, right? Unfortunately, some of the testing does require some testing in the lab in other beings, but the research is not there yet. It's almost there. There was say that the research would be completed by September. We haven't heard anything. As far as I know, the guidelines are still recommending 12 years and over, and so that's where we're at right now. This is everything is again so new that it's still under research and development, and so we need to study more and find out more, and so we're learning as we go along, but that's what we have.
We have a question now from the audience, and again, we have a few. And if you have a question, please call us at 881-0013, 881-0013. This question really could be for both of you, but we'll start with Dr. Alozi. Doctor, one of the viewers has asked a question that they had the Moderna shot and had some fairly serious side effects, apparently, after taking the second Moderna shot. The question is it possible that one could overdose on a booster shot, should that be approved? And I understand that Pfizer is on the verge of getting, or has been approved for, a third booster shot, and I know Moderna is working on it. But when that comes, if and when that comes, would a third shot or a booster have that same possible side effect, or would it in fact be an overdose?
Yeah, so I don't think there's an overdose. And to be clear, the data that exists right now, what we call the safety signals, doesn't show that, right? And so what the booster does seem to show is an increase in the antibody levels of persons. Now again, that will wane over time, and so I think what the vaccines have been consistently remarkable in showing is their efficacy against hospitalizations and death. But to answer the specific question, no, there's no safety signal around getting that third shot that will suddenly pick a new side effect, or a side effect that's that concerning.
No. A booster shot for children, is that something that we can expect as well, based on what you know? And same question, would it have an overdose effect on somebody who's much younger, much smaller, if that were to occur and be approved?
I don't believe, as far as overdose, I don't believe that could happen. The side effects, the common side effects are fever, soreness of the arm. You may feel sick for a couple of days, but it won't go as far as that. I don't think there's going to be an overdose. And as far as a booster shot, I do believe that it's going to happen as far as the pediatric population goes. You have your vaccination schedule in the pediatric population that starts at 2 months, 4 months, 6 months. 1 year, 15 months, and so on and so on and so on. And most of these are boosters, right? So because of the ever-changing immune status of the pediatric population, again, going back to thymus glands and all these technical issues, it is very likely that the booster vaccine will be required. And as previously Dr. Alozi was saying, COVID isn't going anywhere. So just like influenza, we still do our yearly influenza. Each season we have it, ready. So very likely that there will be a booster.
Another question from the audience, maybe to both of you as well, again starting with Dr. Alozi. One question came in from an audience member asking, if someone were to get the regular flu, would that make that individual more susceptible to getting a COVID infection? conversely, if somebody got a COVID infection, does that make them more susceptible or more likely to get a regular flu infection during this season?
Yeah, hard to tell. I think that the really sort of the background question I would ask is, are you vaccinated? Right? If you're vaccinated, unlikely. Right? You may get infected, but again, you're protected from those severe consequences. I will say, though, that getting one virus doesn't preclude you getting the other. We see year after year where people get multiple viruses, whether it's RSV or influenza. Some come in with 2 infections at the same time. And I think the other thing to remember is that when you get sick, that was my phone, when you get sick and you have that damage to your lungs, it actually allows other viruses to enter your lungs and other bacteria to enter your lungs. I think the real sort of take home here, and again, I feel like I sound like a broken record, is get vaccinated to protect yourself against getting it. And again, I say this all the time, if the riddle is how do I protect myself against influenza, how do I protect myself against SARS-CoV-2, then the answer to that has to be vaccinations, right? And so I think we have to continually repeat to people that this is the best way out of this. Because the truth is this, what we're trying to do is change SARS-CoV-2 into a flu-level threat. Now that doesn't sound necessarily great because, like I said, 30 to 80,000 people a year die from influenza, but it's much better than it is right now in the threat. And so we need to change that into a flu level or a common cold level threat. And the best way to do that is to get vaccinated.
Lots of questions from the audience this evening. There was a question about herd immunity, and I'm going to ask a little bit of a variation of the audience question or one of the viewers' questions, and that is, you know, the magic threshold for herd immunity has always been said to be 70, 80%. Or are we close to being at herd immunity, at least for this county, if we're reaching a vaccination rate of 80%? That coupled with the natural immunization that people might have of those who've gotten it. Dr.
I'll take it just because I heard some stuff in the press last week that was wildly inaccurate. Here's the deal. I think that one of the problems is in communication. And at some point in time, and maybe I was responsible for this, maybe others were, I feel like we gave people this illusion that herd immunity was a wall that you hit. And once you hit the wall, everything disappeared like magic. And I think that was the unfortunate part, right? Herd immunity, all it means by definition is the amount of immunity in a community that reduces the transmission of a virus to under pandemic levels, right? And whether you want to call it 60%, 70%, 80%, the fact that we had 60% potentially infected last year, 80% vaccinated this year, we've passed whatever definition of herd immunity months ago. And I think I've been saying this since probably June or July. Now, the Delta variant probably changed some things, made it more transmissible. But again, people need to sort of recalibrate that hitting that herd immunity wall does not mean that COVID disappears. It just means that it's not as transmissible in your community.
Well, along those same lines, I guess then, Dr. Boilea, under that definition or that description of herd immunity, that if a child under the age of 12 cannot get vaccinated, I guess herd immunity becomes almost an irrelevant point, correct? Because of the transmissibility issue.
Correct.
So just to be clear about what herd immunity is, especially with young people, because nobody's been vaccinated under 12, right?
Right. And correct me if I'm wrong, but when you say like herd immunity, to me, it sounds like you're saying, oh, I'm giving you the responsibility to get vaccinated so that if I'm close to you, you're not going to get me sick. And I think that here everybody needs to be responsible, and especially because of the child population not being able to be vaccinated, I think that we have to take care of our younger ones and be responsible about it so that we don't get them sick, because they're the vulnerable ones right now.
Right.
So we're leaving the vulnerable population, you can't really have that coin in the air and say, it's a coin toss and I'll leave it to herd immunity and go from there. I think we all need to be responsible for as a community, for each other, and try and take care of ourselves as much as we can.
Yeah.
The exciting thing, though, in protecting children is that, and the CDC and a host of other organizations released this data a couple weeks ago, in communities that had the highest vaccination rate, the child rate of infection was the lowest, right? And so as a community, because we're able to vaccinate 12 and up, my brain just went away on me for a second,
yes.
12 and up, we are protecting even those that are younger. Now, when the time comes to get them vaccinated, absolutely, vaccinate your child, protect them even further. But again, I think that sort of community responsibility has taken hold. And again, we should be thankful that we live in the community. I mean, you probably saw some of the news of some independent school districts in Austin and some other places that were really literally fighting. That police had to come in and separate people and cancel school districts meetings. We haven't had that issue. Now people get vociferous, right? They're passionate about their views, but we haven't had that, and so we should really be thankful.
Yeah. Another viewer question just came in. I think you've already answered this one, Dr. Alozi, but out of respect for the person asking this question, they may have signed on late. It is, if someone gets a COVID-19 booster shot, how long should they wait to get the flu shot? And I think you answered that earlier.
You can get them at the same time. If for any logistical reasons you need to space them as well. But don't be worried about getting them together.
Yeah. Yeah, and another one I think you answered earlier as well, and it's simply this: is it safe for someone who is over 65 years old and has underlying medical conditions to get both the flu and COVID-19 vaccine?
That's the person that needs to get both vaccines. Right? They are at the highest risk in our community, and so yes, please protect yourself.
Yes, and I think you alluded both to this earlier question. This is another audience question. Last year, it seemed like the cases of the flu, again, were very low. And I think both of you have given the reasons why, and expect that probably to be a trend potentially into the upcoming flu season.
Right, and that same point just proves it over and over again. Face masks work, hand washing works. Distancing works, vaccines more than anything work. So, I mean, the facts are there, and it's been proven over and over. So,
yes, yes. You know, at this point, I think it's really important to point out to our audience. I think we've established the case, not only anecdotally but through data, that if you haven't been vaccinated, that now's the time to go get vaccinated. And we've heard that resoundingly from a number of medical professionals and two very well-respected local doctors. Please go get vaccinated if you have that opportunity soon. And it's very, very important for not only your own health, your family's health, but the health of the community. Dr. Alozi, where can these individuals who have not been vaccinated go get vaccinated? I mean,
it's really everywhere at this point, right? The Walgreens, CVS, the county. Texas Tech has events that they've been doing multiple times. They're focused on boosters right now more than anything else. Call your physician, right? Call the county. Go on epstrong.org, right, and look at where those locations are. But I think there are more than enough places to get vaccinated in our community. Now, are there potentially some pockets that we haven't reached? Potentially, I think it's on the margin. And I think with some of the mandate conversation, different places will have different strategies for people to get vaccinated going forward as well.
I assume, Dr. Boilea, they can come to the hospital or your office to get vaccinated?
I mean, yes, but we have our regular pediatric scheduled vaccines. I have not been able to get the COVID vaccine to distribute. There's some logistics that require for you to be able to hold the COVID vaccine. One of those, initially Pfizer, the temperature of the vaccine was way below zero, so there was some special freezers that needed to be had, and so it just makes it a little bit more difficult for us to keep it in office. So,
new question from our audience. The question is, can you take Tylenol before receiving a booster shot or your vaccine if you haven't been vaccinated?
Short answer, yes.
And I always get it in the office where, can you give him Tylenol before vaccinating my child? Sure.
Absolutely.
Absolutely.
Yeah. We have a little less than 10 minutes remaining in the show. I want to, again, if you have questions, if the audience has questions, please call us at 881 0013. You think I'd have it memorized by now? 881-0013. We do have a little less than 10 minutes, so please take advantage of these two brilliant doctors' expertise in getting your questions answered. One question that certainly has been raised, or people are horrified by these new variants that are coming out, the Alpha, the Delta, the Mu, the Lambda. Based on everything I've seen and read, right now we have nothing to be horrified over, but we still have to be diligent. Is there anything on the horizon, Dr. Alozzi, that scares you? Any new cutting-edge information or data that scares you of any variant that might be emerging anywhere in the world right now?
I don't think there's anything that scares me, right? I think that surveillance is surveillance, and the reason for surveillance is to look at what's going on in other parts of the world, identify what those variants can possibly do. And, you know, again, I think that there's this term called fear porn, and it's unfortunate that the lay media has decided to drive fear porn as opposed to rationality. And so is Mu a variant? Absolutely. Has Mu been shown to have a percentage of vaccine evasion, as they call it? Also absolutely. But as of we know right now, can Mu outcompete Delta? Absolutely not. In all the geographic locations where Mu has been identified, it can't outcompete Delta. Delta is still the most contagious variant, and so that's why in majority of the countries where it's been identified, it makes up 80 to 99% of the virus circulating, right? So is it possible? Possibly, but I think the other thing too, is where I get to geek out on virology a little bit. Viruses only have a certain amount of sort of road that they can mutate through, right? You can't just mutate into this massively infectious virus, then probably you're not going to be able to replicate as well, right? The ones that replicate the most on average are the ones that are able to transmit the most. And so this virus probably doesn't have a lot of places to go. It will continue to mutate because that's what viruses do. Every time they replicate, they create errors, and so those creates problems. And they, again, I think my backstory is if you're worried, get vaccinated. Because here's the thing that we can't control, and I think Dr. Badea will agree to this. You can't control the future. You can control today. And the best way to protect yourself today is to get vaccinated. Now, we can't lose sleep on what's going to happen in 2022, 23, 24 with Mu, Theta, Epsilon, Kappa. I don't know. What I do know is that if you're vaccinated, the chances of you being hospitalized and dying reduced by at least 25 times, and in some communities up to 40 times. And I think that has to be the key that we'll repeat over and over and over again.
And it bears repeating.
Hey,
It certainly
absolutely.
bears repeating.
Right.
Dr. Boalea, I've been reading with some interest, and this would be especially true for parents of young kids, that there might be an oral vaccine or a pill vaccine coming. Is there any new information on that so that a child would not have to undergo the pain of a shot?
I have not heard of an oral vaccine. However, what I do know is that going back to variants, the rotavirus vaccine is an oral vaccine, and so that automatically contains a weakened variant along with the most common strain to avoid variants causing infection. I know that they're trying to mimic the rotavirus vaccine by adding that weakened or attenuated variant. And as far as the method of application, I haven't heard of it being oral. I still believe it's going to be injection, just like measles, just like varicella, you know, all your common shots. And what's the fun out of taking a shot out of a kid anyway, right? So.
Well, thank you for that sage advice there. Along the same lines, Dr. Alozzi, of painless solutions to the virus is the therapeutics and the breakthrough on therapeutics. If somebody gets it, you know, maybe we can nip it in the bud. What do you know about that?
There's a couple of things. I will add that there is some research going on an intranasal vaccine, right, to sort of reduce the transmission since we get this from the air. I think that's important. It's probably not going to be available this year or next year. But I think when you sort of think about the therapeutics, I tell people all the time, if you get COVID, have a conversation with your physician. I feel like a lot of people have sort of forgotten how healthcare works, right? That they just worry about, oh, wow, what does Google say? What should I do? Oh, Google says I should take ivermectin and zinc. And then, but there are a lot of things at work. We know that the polyclonal antibodies, they used to be monoclonal antibodies, right? They actually seem to help to reduce hospitalizations. We know that when you get into the hospital, there's a host of things that clinicians, ICU, ID, whomever can use to treat you, right? But I think, again, here's the thing, and we don't get this in the United States. They do a lot better job in Europe and other places. Prevention is better than cure. It's also cheaper than cure, right? It's a lot cheaper for you to get a free vaccine than for you to get a $200,000 hospital bill if you come to our hospitals. And so that, again, I think we need to sort of focus on that.
Okay, only a couple minutes left. This is going to be the speed round, 1 or 2 seconds on each
Let's
one.
do it.
Number 1, Dr. Alozi, who is qualified to get the COVID booster right now? Caller said they are over 65 years old and immunosuppressed, but we're told not to get the COVID booster. Yes or no?
Check, wrong. Immunocompromised are available to get the COVID booster right now.
Okay, one caller asked if there's research on the side effects and complications of the COVID-19 vaccine. We know the answer is yes, potentially. Is there a short answer that you can give us in about a minute?
I would say yes. I mean, it's just by learning what we've done so far, that's research enough.
We've given out over 200 million vaccines.
Yeah.
We have safety signals, right? I mean, again, it's kind of like the whole, at the Met Gala, Nicki Minaj says she wasn't going to get it because of testicular swelling. It was so bad that the president of that country and the minister of health said absolutely not. They talked to her cousin and he didn't have testicular swelling. Stop believing the internet, believe medical professionals, get vaccinated.
Yeah, well put. Okay, well, those are the closing arguments. I'm a recovering lawyer, full disclosure. I did not do plaintiff's work, you'll be happy to know, both of you. So, but we want to probably close on those very, very strong closing arguments for today's program. Dr. Boadea, thank you very much for spending time with us today, this evening. It's very, very great information. Thanks for coming back to the show, and Dr. Alozi, our famed guest here, who's always here, and we can't appreciate what we owe both of you in the community a whole lot of thanks. The lives you save, the advice you give is truly appreciated by yours truly, and should be appreciated by many in our audience. Madeline, thank you very, very much for your volunteer work, and we appreciate you very, very much. Thank you, and best wishes in your future academic endeavors in medical school. And I just want to thank the American Heart Association again for sponsoring this program, the El Paso Medical Society for many, many years sponsoring this program and being the prime sponsor. And I've been a very poor substitute for Catherine Berg.
You've done a great job.
We have to thank her for over 20 years and her host of doing this. And at this point, I want to say thank you to her, thank you to all of you, and stay safe, stay well, and have a good evening.
You cut that perfectly.
Perfect.
There
That
you
was
go.
perfect.
It's a rip.
Awesome.